The Tennessee General Assembly is in its second week of operation. All of its 9 standing committees are at work. The committee that I chair, State and Local Government, has heard testimony from the Commissioner of Corrections on the growing problem of the growing number of prisoners in our institutions across the state. And in fact, we have created subcommittees to look at this issue specifically in order to find ways to address this problem. But I want to talk to you a little bit about another committee that met this week, the Committee on Health and General Welfare, which talked about issues dear to my heart and important to all Tennesseans. That is the epidemic of drug abuse that we're experiencing in this state. Last year we passed a law called the Prescription Safety Act. I was honored to serve as the governor's sponsor of that bill in the Senate. And I want to tell you a little bit about it since the bill has passed and gone into effect. The bill created and enhanced an existing database to give the professional groups, medical providers, and law enforcement an opportunity to look at the prescriptions being made across the state, to look for patterns of abuse. It also enhanced penalties for this crime called doctor shopping. And I'm pleased to say that the first numbers that we're seeing are showing a reduction in doctor shopping, because we all know that a majority of the pills that are in people's possessions illegally have probably come through doctor shoppers who've got the pills and then spread them across the state. So I'm glad to see the bill that we worked so hard on, the Prescription Safety Act, is now working. And I look forward to monitoring this as the months and years pass. Another bill that we passed 2 years ago to regulate the so-called pain clinics and pill mills in the state is in full effect now. And for the first time, the pain clinics, the pill mills, are now subject to regulation by the state of Tennessee, giving us some oversight for misdeeds that are discovered at these clinics. But these are only 2 parts to a solution that are of a problem that is epidemic across the state. And I filed other legislation this year as we continue our attack on the use of illegal drugs, particularly pain pills. But I'll talk more about that next week. And a word about the budget of Tennessee. Our current budget is about $32 billion. The governor is charged with presenting the legislature his proposal. We're expecting that to come on February the 3rd. And in fact, I'm looking forward to hear his presentation and starting to read the budget. One of the first things that I do when I look at the budget is obviously those programs that are in my district or how my district may be affected by any cuts or increases in revenues to the budget. It's going to be a tough year because we are learning that although maybe revenues are up this year, they are still below the expectations upon which we made our budget. So we're going to have to make some reduction because in Tennessee we keep a balanced budget. The Tennessee Constitution requires us to do that. So we'll see in early February the focus shift to financial matters. But your other committees, such as the 2 that I have mentioned, will continue their work throughout the session as well. And I invite each of you to contact me on any of the issues that I've talked about, or if you've got a problem that I can help you with that involves the state, don't hesitate to call on us. I just appreciate the opportunity to serve, and thank you very much.